What if one simple vitamin before bed could help you wake up with lower blood sugar? Sounds too good to be true, right? But science says otherwise. Researchers have discovered a powerful link between this overlooked nutrient and overnight blood sugar control. It could be the missing piece in your diabetes routine, and most people have no idea. In this video, you'll find out exactly what it is, how it works, and how to start using it tonight. If you wake up with high blood sugar, your body might be missing something crucial, and it's not another medication. This one vitamin could be the key to smoother mornings, better sleep, and more stable glucose levels. Keep watching to discover what it is, why it works, and the best way to take it safely for maximum impact. 1. The problem. Morning blood sugar spikes. Waking up with high blood sugar can be frustrating, especially if you went to bed with normal levels. This common issue is often caused by what's known as the dawn phenomenon. It's not about what you ate right before bed. This spike happens even if you fast through the night. Here's what's going on. In the early hours of the morning, typically between 2 and 8, your body naturally releases hormones like cortisol, growth hormone, and adrenaline to help you wake up and prepare for the day. These hormones signal your liver to release glucose into your bloodstream for quick energy. For people without diabetes, the body responds by producing just the right amount of insulin to manage this glucose release. But if you're insulin resistant, as many people with type 2 diabetes or prediabetes are, your body doesn't handle this surge well. Instead of quickly absorbing the sugar into your cells, it stays in your bloodstream, leading to elevated morning glucose levels. This is why your blood sugar may be high, even if you didn't have a heavy dinner or a late-night snack. The liver is doing its job, but the insulin response is lagging behind or not working properly. What's worse, this morning spike can set the tone for the rest of your day. Elevated blood sugar early on can make it harder to manage levels later, especially if breakfast choices aren't ideal. It can also increase inflammation, fatigue, and cravings for sugar or carbs, making it even harder to stay in control. Understanding the dawn phenomenon is the first step. The next, learning how to counteract it. And surprisingly, one key solution may come down to getting the right vitamin before bed, a simple, science-backed change that could help level things out by morning. 2. The vitamin that helps. Magnesium. The secret weapon for lowering morning blood sugar might already be sitting in your supplement drawer. Magnesium. Magnesium is an essential mineral that plays a critical role in over 300 bodily processes, including blood sugar control and insulin regulation. Yet, studies show that many people, especially those with type 2 diabetes, are deficient in magnesium, which can worsen insulin resistance and blood sugar imbalances. Here's what the research says. Multiple clinical studies have found that magnesium supplementation can improve insulin sensitivity, reduce fasting blood glucose, and help regulate glucose metabolism overall. One study published in Diabetes Care found that people with low magnesium intake were significantly more likely to develop type 2 diabetes. Another study revealed that magnesium supplements improve blood sugar levels in people with both diabetes and prediabetes, especially when taken consistently. But magnesium doesn't just help directly with blood sugar. It also improves sleep quality, which is crucial if you're trying to control overnight and morning glucose spikes. Poor sleep increases stress hormones like cortisol, which in turn drives blood sugar higher. Magnesium helps calm the nervous system, reduce nighttime awakenings, and support deeper, more restorative rest. On top of that, magnesium has anti-inflammatory benefits, which is especially important for people managing chronic conditions like diabetes. Lower inflammation means less stress on your body's insulin-producing cells and better overall metabolic health. Whether you take it as a supplement or boost your intake through foods like pumpkin seeds, almonds, spinach, or dark chocolate, magnesium can make a real difference. Taking magnesium before bed may be one of the simplest science-backed strategies to combat the dawn phenomenon. Lower your fasting glucose and start your day on the right foot. Number 3. How it works while you sleep. So, how exactly does magnesium work its magic overnight? Magnesium is often called the relaxation mineral because of its calming effect on the nervous system. It plays a key role in regulating neurotransmitters that quiet the brain and prepare your body for rest. When you take magnesium before bed, it helps lower stress hormone levels, especially cortisol, which is notorious for spiking blood sugar during the night and early morning hours. But there's more. Magnesium also supports muscle relaxation, helping you fall asleep faster and stay asleep longer. Why does that matter for blood sugar? Because deep, uninterrupted sleep is when your body does much of its repair work, balancing hormones, reducing inflammation, and restoring insulin sensitivity. Poor sleep, on the other hand, raises glucose levels and makes your body more resistant to insulin the next day. During deep sleep, magnesium promotes stable blood sugar by enhancing cellular glucose transport and reducing oxidative stress. That means your body is better able to move sugar out of the bloodstream and into cells where it's needed, instead of letting it build up overnight. And let's not forget how magnesium supports the production of melatonin, the sleep hormone. Better melatonin levels not only help you get quality rest, but also work in tandem with insulin to regulate your circadian rhythm, your body's internal clock that influences blood sugar control. In short, magnesium works on multiple fronts while you sleep. It soothes the nervous system, improves sleep quality, relaxes muscles, reduces inflammation, and enhances your body's ability to manage blood sugar. It's a powerful, natural ally in fighting morning glucose spikes, all while you rest. 4. Best forms and dosage. If you are ready to add magnesium to your nighttime routine, it is important to choose the right form and dose for the best results. The most effective and well-tolerated forms are magnesium glycinate and magnesium citrate. Magnesium glycinate is especially known for its calming effects, making it a great option before bed. It is gentle on the stomach and helps promote deeper, more restful sleep. This is perfect for anyone looking to improve both blood sugar and sleep quality. Magnesium citrate is also well absorbed and can help support digestion, though it may have a mild laxative effect for some. Aim for a daily dosage between 200 to 400 milligrams, ideally taken in the evening, about 30 to 60 minutes before bed. This gives your body time to absorb the mineral and begin its calming effects before you fall asleep. One form you will want to avoid is magnesium oxide. It is often found in cheaper supplements, but is poorly absorbed and mostly acts as a laxative without offering the full metabolic benefits. For blood sugar control, better sleep, and reduced inflammation, stick with glycinate or citrate. Also, if you are taking medications or have kidney issues, talk to your doctor before adding magnesium to your routine. While it is generally safe for most people, it is always smart to make sure it is the right fit for your personal health needs. With the right form and dose, magnesium can become a simple but powerful tool in your evening routine, helping you wake up with steadier blood sugar and more energy to take on the day. 5. Food sources versus supplements. Magnesium is found naturally in many healthy foods, and incorporating these into your daily meals is a great way to support overall health. Some of the best magnesium-rich foods include pumpkin seeds, spinach, almonds, black beans, avocados, and dark chocolate. These foods not only provide magnesium, but also offer fiber, healthy fats, and antioxidants that benefit blood sugar control. However, for people with diabetes, especially those dealing with high morning blood sugar, diet alone may not be enough. Studies show that many diabetics have lower magnesium levels, often due to increased urinary loss of the mineral caused by elevated glucose levels, even with a balanced diet. It can be difficult to consistently get the optimal amount of magnesium needed to regulate blood sugar and improve sleep quality. This is where supplements can help fill the gap. A well-absorbed magnesium supplement ensures you are getting a reliable dose each day, especially when dietary intake is inconsistent or your body's demand is higher. Supplements also offer a more targeted approach. If you are looking to specifically address nighttime blood sugar spikes and sleep issues. That said, food should still be your foundation. Think of magnesium-rich foods as your daily base and supplements as your insurance policy, especially if you are struggling with symptoms of deficiency like poor sleep, muscle cramps, fatigue, or stubborn blood sugar levels. In short, aim to get magnesium from both your plate and your supplement bottle for the best results. Combining both approaches can help you reach and maintain healthy magnesium levels, giving your body the support it needs to regulate blood sugar more effectively, especially overnight. Tips for safe use to get the most benefit from magnesium while keeping things safe. Timing and dosage are key. Take your magnesium supplement with dinner or about an hour before bed. This allows your body to absorb it gradually and supports better sleep and overnight blood sugar control. Never exceed the recommended dose, which is typically between 200 to 400 milligrams per day for most adults. Taking too much can lead to side effects like diarrhea, low blood pressure, or imbalanced levels of other minerals like calcium. Also, check with your doctor before starting magnesium, especially if you are already taking medications for blood pressure, heart conditions, or diabetes. Magnesium can interact with certain drugs and either boost or block their effects, so it is essential to get medical advice first. If you experience any unusual symptoms after taking magnesium, like daytime drowsiness, changes in heartbeat, or digestive upset, talk to your healthcare provider right away. The key is to start low, go slow, and listen to your body. When used correctly, magnesium can be a powerful ally in your diabetes management plan. Conclusion: this simple bedtime habit might be your secret weapon against those stubborn morning blood sugar spikes. Adding the right form of magnesium could help you sleep better, feel more rested, and wake up with steadier glucose levels. Try it out and track your numbers. You might be surprised at the results. If you have used magnesium before or plan to start, share your experience in the comments below. Do not forget to like this video and subscribe for more science-backed diabetes tips every single week.